Good morning.
How are you today?
I'm doing great. How about you?
I'm doing good. Your name is Dia.
Yep.
I'm Michael, teacher Michael.
Yeah,
Nice to
nice
meet
to
you.
meet you.
So what are you up to today?
Up to?
Mm, That's an English expression. It means like what are you doing? What are you going to do today?
Well, uh, I'm gonna work.
Okay,
Yeah, I
cool.
have my clinic in the afternoon.
You have
Yeah,
your
and
what?
then yeah,
You have
I am working as a doctor in the
Okay.
hospital. Yeah, so I have clinic in this
Cool.
afternoon. So in the morning, maybe
Awesome.
I have my time for studying English.
Cool. Mm. What kind of doctor are you? What kind of medicine did you study?
Radiation oncology. Have you ever heard about it?
Yeah, one of
Mm.
my girlfriends in college, her father worked in the radiology department, the nuclear medicine department.
Oh, yeah, but it's a little bit different. The nuclear
Yeah,
medicine is diagnostic part, and we are,
right.
yeah, treating cancer
Like what?
patients.
Okay, that okay.
Mm-hmm.
I used to work in the hospital too.
Really? Oh.
Yeah, I worked in the central supply and
Uh-huh.
transportation. So I would make the surgery linen,
Uh-huh. Uh-huh.
and then I would autoclave it and
Mm-hmm.
sterilize it, and also surgery sets for like vaginal inspection sets and
Mm-hmm.
circumcision sets and
Yeah.
all of the surgery linen and
Uh-huh.
gowns. And then I would also take the carts
Uh-huh.
from the ground floor.
Mm-hmm.
From each floor has their own supply cart. Then we take it
Yeah.
downstairs and refill it, and then take
Uh-huh.
it back up to the room. We switch them out.
Yeah, yeah. Oh, you did
Yeah,
very important thing. Yeah,
yeah,
sanitation is really important issue
right.
in
And then I
hospital.
used to
Hmm.
transport patients from their rooms in on a gurney or in a
Uh-huh.
wheelchair, going
Yeah.
for diagnostic like tests. Or
Uh-huh.
I took many patients to radiology.
Uh-huh. Yeah, yeah. Radiology part is one of the busiest
Yeah,
part
it's
in
like in and
hospital.
out,
Yeah.
in and out, in and out.
Mm-hmm. That's
And
right.
then sometimes the patients who have brain cancer,
Mm-hmm.
after the radiation treatment, they act a little strange.
Yeah, yeah, but mostly due to their tumor. Yeah, brain
Right.
tumor. Yeah,
They have
and
some behaviors.
yeah, and after the treating radiotherapy, yeah, maybe some brain edemas can happen. So
Right.
yeah.
Sometimes they start laughing, and then when you're pushing the gurney, they put their arms in the doorway and
Yeah.
stop you,
Uh-huh.
and like don't, and then they laugh at you,
Oh.
laugh at you like,
Mm.
and they go, I can't go, and put your arms down, and then you try to
Uh-huh.
move, and they stop you again.
Oh, that's
I had
dangerous.
some patients playing around.
Uh-huh.
Yeah, I used to take them to the sleep lab,
Mhm.
to the nuclear medicine,
Mhm.
to have angiograms
Yeah.
and
Oh,
angioplasty and all kinds of stuff.
yeah. You're really accustomed to every hospital system. Yeah. How long did you work in the hospital? Maybe
That was
it's long.
like almost 2.5 years.
2.5. Oh, quite
Yeah,
long. Uh-huh.
yeah. So yeah, that was transportation, sterilization. I had to take patients everywhere. Sometimes even to the morgue. That's
Mm-hmm.
unfortunate.
Mm-hmm. Mm-hmm.
So,
Yeah, that's right. So,
so you're an oncologist?
yeah, oncologist.
Hmm, that's good. So do they still tattoo the head with the small marks, or no more?
Well, usually we make the masks, thermoplastic masks. So we melt
Mhm.
it, and we made yeah, the mask to
And
patients
it has
to
the
not move.
marks. It has the marks
Yeah, yeah. Also on the mask, we have
on the
also
mask.
marks. Yeah, on the
Oh,
masks.
that's cool.
Mhm.
That's a lot better because they used to tattoo them. They used to put like tattoos
Uh huh.
on their skin.
Yeah.
I I think they were temporary. I'm not sure, but
Yeah, they after that they might be remove that, but yeah, in my hospital, yeah, we usually just put the plaster on the masks. Yeah, not
okay.
tattoo. Hmm.
Oh, that's good. That's nice. A lot of
Yeah.
changes. So, yeah, how long have you been doing that?
Ah, well,
Ah,
I'm a young doctor, so
yeah,
I'm
that's obvious.
yeah, 7 years because that's obvious.
7 years.
Yeah.
Wow, very cool.
Yeah, and 4 years of
Yeah.
a training course, and yeah, 3 years
Uh-huh.
as a true radiation oncologist, and yeah.
Yeah. So you got to be careful. You have your protective badge, you have your
Yeah, that's right.
radiation badge, and
But I feel I'm the most safe person,
uh-huh.
because yeah, I have my
Why?
badge on it, and
Uh-huh.
yeah, the how can I say, the system, the the equipment system is complete to
Okay.
yeah
You
to
have
block
protective gear,
yeah
protective vest?
that no, because the equip equipment for blocking the radiation from
And
the
the wall.
yeah, the wall, yeah,
The wall and
that's
the glass is treated already, right?
yeah, so that's enough, so we do not wear vest.
Okay.
Uh-huh.
That's cool.
Yeah, except yeah, I think the doctors wear vests if
Uh-huh.
they should stay with the patient in CT room or angio.
Right.
Yeah, yeah, angio, the
Angioplasty?
angiogram. Yeah, yeah,
Angiogram.
having the
Yeah.
angiogram. So.
That's yeah. Hopefully I never have to have any of that.
Yeah,
No.
yeah, I think you must be
No.
healthy and take care about yourself a lot.
Yeah,
You have good fit.
I saw too much death in the hospital, so
Yeah, that's
the
right.
cancer the cancer patients were the it's like really sad because most of them die.
Yeah, yeah.
So I have met one man who was like 40. He was a CPA accountant,
Mhm.
very successful business. He had three daughters, and
Mhm.
you know his prognosis was not good.
Yeah,
He had
yeah,
lung cancer, and
yeah.
like he was angry, and
Mhm.
yeah, I don't know if he died, but I'm pretty sure he did. But
Yeah.
he was young, that's young, 40,
Uh-huh. Uh-huh.
40 years old.
Mhm.
I'm 51, so I
Yeah.
couldn't imagine that.
Yeah, that's right. Too young to die. Yeah.
Yeah,
But yeah, the lung cancer is the one of the uh aggressive
yeah,
and yeah,
very.
have bad prognosis. So, yeah, and 40 is too young. Yeah, because I am young, so whenever I meet
Mhm.
young cancer patients, I'm quite I'm not used to it. Yeah, and it's hard to explain about their prognosis to them because
Right.
maybe if I am older than them,
Uh-huh.
maybe yeah, I can explain it in more how can I say well, but I'm young and the patient is young, and maybe the patient feel awkward and yeah, feel
Why?
more
Why do you think they feel awkward? Because you're young? I don't understand.
uh oh well, I'm not sure because well, I think I uh put much emotion to them. That's why. Yeah, I don't
Ah,
know.
okay.
I don't know they feel uh I feel awkward really, but I don't know. I'm not sure, but
Don't they
I
have
feel
classes when you're in medical school to teach you how to like talk to people about things like that?
yeah, well, yeah.
Like
But thankfully I'm
like
not
psycho
the
like psychology classes to help you like counsel people?
counsel people. Yeah, we have
Mm.
a um, how can I say, the trained actors who act like a patient who diagnosed as cancer, and
Oh, that's cool.
yeah, and we learn how to tell them
Mhm.
about the bad news. Yeah, we
Mhm.
have to, yeah, prepare the tissue, and if the patient cry, then we do not say nothing. We have to say nothing and just put the tissue to the patient. And
Uh
yeah,
huh.
well, I understand your feeling and like those kind of how can I say, the empathy. Yeah, take
Yep.
we learn expressing the
Yep.
empathy to the,
Empathy,
yeah,
right?
patient.
You
So
want to
yeah.
stay away from platitudes.
Uh-huh. Yeah.
Those are scary. You know what platitudes are?
Platitude, no.
It's like something. It's like things people say to try to make you feel better when something bad happens,
Ah.
but it's like they're like cliches. They're
Yeah.
platitudes. They're
Oh.
it's like like well,
Cheer
we're
up,
all
cheer
gonna
up.
we're all cheer up,
Oh,
or
yeah.
we're all gonna die someday, so
Oh,
oh
yeah.
no,
That's, yeah.
no,
So,
that's not
but if
good.
I did not learn that, then maybe I did yeah, I did mistake. But after learning that, learning the class and with those kind of training,
Yeah.
yeah, I just
Yeah, you might
listened
be
to
like,
them.
ah, don't be such a crybaby. There's some people that died 5 years before you. You got 5 years longer than them. That doesn't help either, right?
uh,
So harsh.
yeah, and well, and it depends on the patient's characteristics. Yeah.
Yeah.
So,
Yeah, some people are crybabies about everything. So
mhm.
other people are strong and they can deal with,
Yeah, and
adversity.
they want me to watch the to learn about his or her status clearly. Oh well, yeah.
Yeah, but you don't always know. Some people respond to the treatment better than others.
Mhm.
If it's me, I'm not gonna have treatment. I will just not have it because I saw the effects of the chemo and the radiation, and I don't like it. So,
Well, it depends on the site of the treatment. Yes. So I know that head and neck cancer treatment is really hard for the patient,
uh-huh.
but
Yeah.
the radiation therapy for breast cancer or pelvic tumors is,
Mhm.
is quite tolerable. Yeah.
But
So
what about the leukemia risk? There's quite a big.
leukemia, leukemia is,
Yeah.
yeah, actually the major treatment is chemo. So yeah,
Right.
the yeah, and the chemo is really yeah, hard treatment. I know it,
Right.
but
But I mean, like, for example, if you have like a pelvic tumor,
mhm.
and then you get chemo and radiation, the radiation's gonna leave you exposed to leukemia maybe 5 years later. You
Ah,
have
but
a
the risk for adult is not that high.
uh-huh.
So yeah, secondary malignancy, secondary
Uh-huh.
cancer is not. It does not happen very, yeah, uh, uh, frequently. It's rare,
Yeah,
and it happens usually 20 or 30 years.
right.
So. Mm-hmm.
I'm gonna trust my immune system. I think I want my immune system to work, and if I use chemo or radiation, it's gonna destroy it. So I don't want any secondary infections or illnesses caused by
Uh huh.
weakening my immune system. So
Yeah, and I think prevention is the most important. Important,
yeah,
yeah.
don't drink, don't smoke,
Yeah, and
exercise,
regular exercise.
get enough sleep. Most
Mhm.
people don't get enough sleep, so the stress
Yeah, stress. Uh
they
huh.
experience from not getting enough sleep,
Mhm.
that's a big thing too.
Yeah, that's right.
People sleep like next, and they have so much radiation, like they have their cell phone next to their bed, they have their laptop in their bed, they have a lot of radiation, they have a lot of Wi-Fi connections.
Yeah, but usually we say that those kind of, yeah, Wi-Fi or, yeah, electronic devices is not that Yeah, there's no evidence. Yeah, yeah, we
There is,
doctors
there
love
is.
evidence. There is?
Yeah, there's a lot of evidence.
Oh,
In
but
fact,
I read they
there's quite a
mentioned.
few people that
Uh-huh.
are bringing. There's a lot of few, quite a few people who are bringing up old studies that were
Uh-huh.
done
Uh-huh.
on electromagnetic radiation and
Uh-huh.
Wi-Fi radiation
Uh-huh.
from a long time ago,
Uh-huh.
and there is an effect. It does have an effect.
Yeah,
So of course,
but
the people
conflict. Uh-huh.
who are promoting it don't want there to be an effect because
Yeah, that's right.
they're marketing a product. You know, they're marketing more than just the more than just the smartphones. They
Uh-huh.
want to connect all machines,
Yeah.
everything
Uh-huh.
to the internet. So they want connectivity with RFID chips everywhere in the clothes, in the food.
Uh-huh.
So
Yeah, maybe then we have to more, yeah, have more how can I say intention about
sure,
that problem. Yeah,
yeah,
and I'm sure that the smartphone and laptops make people have more musculoskeletal problems. Like, yeah,
right,
everybody's looking at like the turtleneck.
right.
Yeah, so
So we'll see in the future. We'll see because if rates of tumors or cancer or
yeah, maybe. Uh-huh.
electromagnetic burns, I heard of
Mhm.
some people getting burnt, their
Mhm.
skins getting
Mhm.
burnt from
Mhm.
because some of the 5G antenna are like on top of some apartment buildings, and people
Mhm.
living just below those antenna
Mhm.
are complaining about problems. So,
Oh.
mm,
Mhm. Yeah. Yeah, we'll wait and see. Yeah, and ah, maybe there's some.
yeah, if you see like if there's more and more people suffering from problems, especially in cities where there's going to be a lot of antenna
Mhm.
for the
Yeah,
connective
yeah, that's true.
devices, then you'll see a correlation probably between people who live near them and people who
Mhm.
live far away from them.
Mhm. Mhm. Yeah, there
Or
must be a research for those kind of yeah, effects.
yeah,
Yeah.
well, radiation has an effect, and electromagnetic uh, signals.
Mhm.
We don't know. There's different. They have each each form has its own wavelength,
Yeah, that's
its own
right.
effect. And the microwaves are getting so small they can
Uh-huh.
affect even the hair follicles in your skin,
Yeah.
act as antenna, and can like cause sensations or
Uh-huh. Because I am
reactivity.
dealing with the mega voltage of radiation, so
Yeah,
yeah, for me it's quite trivial. Yeah, it's quite a little energy for me, but yeah,
right.
we don't know that we have to yeah analyze and research about it also. Yeah, I'm
Sure,
sure.
exactly.
Yeah.
So, do
So
you have any hobbies? What do you do for fun?
for fun, yeah, I love
Yeah.
exercise.
Oh,
Yes.
cool. Do you like
Uh-huh.
Pilates, yoga,
Yeah,
weightlifting?
everything. But the most exercise I love is dancing. Yeah.
Ah, dancing's
Yeah,
awesome.
I learned the girl groups in Korea, the K-pop.
Oh,
Yeah,
cool.
I learned
Wow.
that's very interesting and
Yeah,
yeah.
it is. That's awesome.
Yeah, I'm not that good at dancing, but it's
Uh-huh.
just for fun. And it's really yeah, give me a tremendous joy for life.
Right.
Yeah.
What kind of dance do you do?
Well, like the red velvet, or
Yeah,
the
okay.
yeah, or the I forgot this name. The Twice, yeah, those girls recent.
What about Blackpink?
Like oh yeah, also Blackpink. I learned one of their yeah dance.
Wow, that's cool.
Yeah.
So you got through med school and you've been practicing medicine for like 7 years. That's pretty awesome.
Well, actually, the medical course in Korea is 6 years. Six
Uh-huh.
years, and after that, I have 1 year of internship and four
Uh-huh.
year of residency, and
Mhm.
after that, 2 years of fellowship.
Oh my God.
Yeah,
It's endless.
and last, and this year, yeah, I am a clinical assistant professor. Yeah.
Okay, awesome. That's good. You're moving
It's
up.
quite long. 10 years of training course.
Must have been hard on your personal life. No time, no free time.
Yeah, but I think it's worth it. It's a good job. And
Yeah,
yeah,
that's
meaningful
cool.
job. Yeah.
All right, well, I got to get going, but I'll see
Mhm.
you next time. Let's do it again, okay, Dina? Dia?
Oh, okay. Yeah.
Let's have a class again soon, and we'll talk
Yeah,
more
nice
about
talking to you.
internal medicine and different kinds of cancer,
Okay.
like brain cancer, like glioblastomas and stuff like that.
Oh, yeah. Oh, that's. I don't want to talk about it. It's really.
Okay, we'll talk
Yeah.
about something else.
Okay. Yeah.
Take care.
Yeah. Bye.